Hi, my name is Galvin Kennedy, and I have represented hundreds of nurses around the state of Texas who claimed that they should have been paid for meal periods because they were required to remain responsible for the health and safety of their patients. And that makes sense because under the Nurse Practices Act, the professional code that applies to nurses says that the nurses remain responsible for the patient care even when they're on their meal period. A lot of hospitals have what's called a buddy system, where they supposedly have another nurse that is going to keep an eye on their patients. But under the Nurse Practicing Act, the nurse remains responsible for those patients who were initially assigned to her. And that makes sense, right? The nurse that has been with the patient for the last 4, 5, 6, 7 hours is going to have more intimate knowledge about their vital signs, what medicines they're taking, and their general status. So when they try to pass those patients temporarily off to another nurse while they try to eat, they still remain responsible for the health and safety of those particular patients. Because they remain responsible, they are never relieved of their duties. That means that this meal period, where they're subject to being interrupted, is not a bona fide meal period under the law, and they should be paid for it.